At least 4,000 people in the Republic of Congo have been affected by the Chikungunya epidemic in the southern part of the country. Health officials in the country are calling on the population to take preventive measures, including the use of mosquito nets. The first cases of this epidemic were detected in January in the coastal city of Pointe-Noire by the National Institute of Biomedical Research in Kinshasa. And since then, Congolese authorities have been monitoring the evolution of the disease. Symptoms of the virus appear between 4 and 7 days after the patient has been bitten by the infected mosquito. And these include high fever, joint pain, joint swelling, rash, headache, muscle pain, nausea, and fatigue.
As you said, Lynette, this disease mainly affects the female layer. To elaborate this, we are joined online by Dr. Ulrich Judicae-Biez, Director General of the Brazzaville Hospital. Doctor, almost all divisions have been affected by this epidemic. Tell us, what's the current situation like? Indeed, Congo has been experiencing an outbreak of chikungunya since January. To date, we have recorded just over 4,000 cases. Fortunately, we have not had any deaths. It must be said that chikungunya is a viral disease that is similar to madness, but not madness. And it is characterized by high fever, headaches, nausea, and vomiting, and especially joint pain and muscle pain. They can become very, very severe or even disabling, which is what we call here in Congo, malaria pongo. Malaria because it is similar to malaria, and pongo because at some point it breaks the body and you have trouble standing up. You have trouble walking.
And at least 4,000 people have been affected by this mosquito-borne disease since January. But it seems that the response is not proportionate.
The government of the Republic, supported by technical and financial partners, did not wait. Immediately the first cases were diagnosed, there were still less than 100 cases in Kwilu and Pointe-Noire. Teams from the Ministry of Health had been mobilized for this purpose, including those from the World Health Organization and other partners. Local authorities were mobilized as well as civil society organizations. So we can say that there is more or less a great response. As I speak to you, there are Ministry of Health teams deployed in the divisions where affected health districts, teams from the Directorate, the Disease Control and Epidemiology Directorate of the Ministry of Health are located in the affected health districts, organizing the response. There is currently no vaccine against this disease. How can we effectively fight against the virus? Indeed, it must be said that we do not yet have a vaccine against this disease. Although it is a disease caused by a virus, there are no specific antiretrovirals that allow us to fight this disease. Therapeutic measures are essentially therapeutic in nature. It's about threatening fever. It's about treating pain. So symptomatic treatment. It's about rehydrating patients. And so that's what's being done.
And maybe a last question. What do you think are the preventive measures that the population can take to avoid further spread of this chikungunya virus?
The main aim is to intensify vector control. It is necessary to explain to the populations that they must control breeding sites. They must weed around them and have a completely healthy environment. But also, the use of mosquito nets in windows and doors, and long-sleeved clothing should be promoted, especially during the day. That is, during the morning hours and in the early evenings. Because the mosquito that is responsible for the transmission of chikungunya, unlike the one that causes malaria, bites more during the day, does not bite at night. So it is a question of explaining all these things to the population, and we think that this is what we are doing today in an intensive way, and therefore the populations must adhere.